Welcome to today's lecture on Coxsackievirus infections, a dermatological perspective, Introduction to Coxsackieviruses. Coxsackieviruses are a subgroup of the enterovirus genus within the Picornaviridae family. This family also includes other significant pathogens like poliovirus and echovirus. They are pivotal human pathogens with multiple species identified, labeled from enterovirus A to I. These viruses have been under increased scrutiny, especially as the global control of poliovirus has shifted focus toward understanding and managing non-polio enteroviruses like Coxsackieviruses. Virology of Coxsackieviruses. Coxsackieviruses are non-enveloped viruses with linear, single-stranded RNA. They are categorized into two groups based on their pathology in mice, Group A and Group B. Group A is associated with flaccid paralysis due to generalized myositis. Group B, on the other hand, leads to spastic paralysis because of focal muscle injury, impacting neuronal, pancreatic, and myocardial tissues. Pathophysiology, transmission. The primary modes are via the fecal-oral route and respiratory aerosols, though fomite transmission is also possible, replication and dissemination. The virus initially replicates in the upper respiratory tract and the distal small bowel, followed by viremia, which leads to systemic dissemination, persistence and immune response. The virus can persist in the respiratory tract up to 3 weeks post-infection and in feces for up to 8 weeks. The body's defense involves innate, humoral, and cell-mediated immunity. Clinical manifestations. Group A typically affects the skin and mucous membranes, leading to conditions like herpangina, acute hemorrhagic conjunctivitis, and hand, foot, and mouth disease. Group B tends to impact internal organs, causing diseases such as pleurodynia, myocarditis, and hepatitis. Dermatological clinical features: hand, foot, and mouth disease. HFMD presents with vesicles and ulcers on the hands, feet, and oral mucosa, mostly affecting children but occasionally seen in adults. Particularly during outbreaks. Herpangina, characterized by vesicular lesions on the posterior oropharynx, commonly in children. Acute hemorrhagic conjunctivitis, notable for severe eye redness and hemorrhage without pus. Associated with significant discomfort. Diagnostic approach. Diagnosis is largely clinical, supported by PCR testing to confirm the virus type and serology for retrospective confirmation. Treatment and management. Supportive care, the mainstay for most Coxsackievirus infections, including hydration and pain management. Specific treatments. While no antiviral therapy specifically targets Coxsackieviruses, topical anesthetics can alleviate pain from oral lesions. Severe cases may require more aggressive interventions like IVIG or investigational drugs like plecanerol, especially in complicated cases. Preventive measures. Focus is currently on vaccine research, particularly for preventing severe outcomes like those from HFMD. Conclusion: Coxsackieviruses present distinct challenges, especially in dermatology, given their diverse cutaneous manifestations. Understanding these can aid significantly in early diagnosis and effective management. Ongoing research and diligent supportive care are crucial as we look toward developing targeted treatments and preventive measures. Final notes: as dermatologists, staying updated and aware of these infections enables us to minimize complications and manage outbreaks effectively, enhancing patient care and public health. Thank you for your attention, and please remember to like and subscribe for more insightful discussions on dermatological conditions.